following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, medications. Two experts are here to answer your questions. Now here's your host, Dr. Maureen Hashmi.
Good evening. It's a good idea to regularly take stock of what's in your medicine cabinet, whether it's over-the-counter or prescription medications. Throw away what's expired and replenish the first aid kits, and make a list of what you take every day and the dosages. Do you know what you're taking and why you're taking it? What are the potential side effects of the medications? Is the over-the-counter medication safe and effective? We'll get answers to those questions and more tonight from our two guests, Dr. Charles Ponte, a pharmacist in the Department of Family Medicine at WVU and the School of Pharmacy, and Dr. Gretchen Krekel, a clinical pharmacist who's also in the WVU School of Pharmacy. If you'd like to ask our guests a question, give us a call. Our phone lines are now open. Charlie, so let's start with you. October is American Pharmacist Month. What is that about?
Well, that's a good question because, as you said, October is American Pharmacist Month or Pharmacist Month, and the mantra for the month of October is "Know your medicines, know your pharmacist." So it's a great way for the pharmacy profession to kind of showcase itself to the public as to its value and the services that they provide to patients, and really their role in healthcare. Mm-hmm. So a lot of organizations and a lot of activities are planned for the month, again, sort of highlighting the kinds of services that pharmacists can provide and really their value to patient care.
And really what an integral role they're playing. So on kind of that line, Gretchen, can you tell us a little bit about the pharmacist's role in healthcare now?
So pharmacists are definitely the medication experts. They're the most accessible healthcare professionals. So patients, if they have a question, they can run into the pharmacy and ask their pharmacist about their medications, and the pharmacist knows when to refer them to their doctor if they should need further review. And also the pharmacists are now able to give flu shots and pneumonia shots in the pharmacy. So that's where we're seeing a big need this fall, is with patients coming into the pharmacies and getting their flu shots and pneumonia shots.
That's a great service. In terms of kind of general advice for patients in terms of using one pharmacist, can you maybe elaborate a little bit about why that's important?
Sure. So it's very important that patients use one pharmacy and one pharmacist because then the person knows all of their needs and what medications they're on and can follow them more closely. If someone's going to many different pharmacies, they're not going to know what all of the other medications that you're on. So it's best to get everything in one place so that you can be closely monitored.
And I think that's important also from a clinical perspective for providers to encourage patients to do that also, because sometimes the patient may say, well, it's closer today for me to go to such and such pharmacy, but that's not the one I usually go to. And how dangerous that can be in some cases if they're starting a new medication that their pharmacist isn't aware of. Any other advice in terms of taking medications as directed, updating the medication lists for the pharmacist? Any of those?
Well, I think as a rule, I think I try to tell patients, and I think the audience really needs to hear this, that anytime they see a provider, be it a physician, dentist, even when they go visit their pharmacist, really they should bring all of their medications with them. I think it's very important for the provider, let's say their family doctor, to kind of review their medications with them to really see what sorts of products, or medications they're taking that may not be necessary, that perhaps can be eliminated, because the more medications you take, the more likelihood that there would be drug interactions between one or more of their medications. Oftentimes, side effects of one medication are treated with another medication. And so what this does is it sort of increases then the number of medications that a person may take. And again, increasing the chances, I think, for sometimes a bad outcome, such as an adverse effect or a drug interaction that could lead to something more significant or serious for the patient.
That makes sense. We actually have a caller already. Flora from Mercer County. Flora, go ahead with your question.
Yes, sir. On a few different medications. I don't think any of it has to do with this. It's a burning sensation only in my scalp, and then it gets itchy. Later, it breaks out into a circular red circle type, somewhat circle, and then in the center, it gets like C type of looking. And I've been to dermatologist after dermatologist to no avail. And my cat, I took her in for her vaccination, and they gave me some shampoo for her. I was so desperate, and I used it, and it healed my head up. So I would just like to know what your thoughts on that.
What medication was that, Flora, that you took, that you used that worked?
Go get the shampoo. It's a, hold on just a minute, honey. Hurry, run, quick. I'm sorry.
Sounds like a topical medication.
Yeah. Flora, while you're still on the line, it's certainly possible that, I don't know what you have because you really need to be seen by your family doctor or another specialist to sort of determine what you have. But, there are a lot of conditions that animals, your pets get that are very similar to what you get as a human. And oftentimes the medications are very similar, if not the same. So it doesn't surprise me that she had this skin condition and the cat was treated for maybe a similar condition and it helped her. The only advice I would say, though, is try not to do that because, one should not really be taking their pet's medications for themselves because sometimes there are differences that may lead to perhaps a side effect or some other adverse effect. So in this case, it worked out, but it may not always work out.
And there may be a human equivalent that
absolutely.
would work more.
Well, it's an antibacterial and antifungal medicated shampoo. And like I said, I'd been to my medical doctor, which he said he's never seen anything like that before. And he sent me to several dermatologists, and all these medicines and creams they had gave me was not doing any good. And she just had some hair thinning, and this is antibacterial and antifungal medicated universal shampoo from the vet.
Well, it worked for you, Flora, and, you described, again, I'm not in a position to diagnose what you have, but, there are sort of fungal skin conditions that sort of have that circle sort of appearance. And maybe just it helped and it worked, but in reality, it's something I don't really advocate that patients take their pet's medication.
We actually have another caller, Virginia from Mercer County. Virginia, you're on Doctors on Call.
Yes,
Go ahead with
ma'am.
your question.
I hear some things about Fosamax that I just wonder. If you take calcium 1,200 micrograms a day and 50,000 units of prescribed vitamin D twice weekly a month, is Fosamax necessary?
So I'm assuming you're taking this for osteoporosis. Is that assumption right?
Yes, ma'am.
Okay. So I think what she's getting back to is, can calcium and vitamin D supplementation alone help treat osteoporosis?
Well, I guess the short answer to that is yes, it can. Vitamin D, if you take sufficient amounts of vitamin D and calcium, and again, not knowing specifics with respect to how maybe brittle your bones may be, or if you've had further testing to determine that. But it's certainly within the realm of being reasonable to take a drug like Fosamax along with a calcium and a vitamin D supplement.
Yeah, the general recommendations for osteoporosis when you're being treated with Fosamax or a bisphosphonate is that you need to take the recommended daily allowance of supplemental calcium in addition to your vitamin D so that you can absorb the bisphosphonate or the Fosamax. So that's appropriate. Certain types of osteoporosis can actually be treated with vitamin D if it's in certain areas, either generally the hip rather than the spine. So you're probably getting double treatment, one for the spine and one that's also treating the hip. But you do need calcium and vitamin D to help treat your osteoporosis and get those medications to absorb. Okay. How about a little bit about generics versus brand name drugs? Because we get a lot of questions from patients about that. What's the difference? Is one better than another? Are there some drugs that I can take a generic, like heart medications or birth control pills, or are there some that are better to stick with the brand?
That's a very good question. And a lot of patients do have questions about those types of things. So it is important to try and stick with the same generic if you do switch from a brand to a generic, because there can be slight variations, but they're all tested to make sure that they work the same way. A new one that's coming out soon that a lot of people are probably going to be interested in is Lipitor. Lipitor has been a expensive brand name medication for a number of years now, and a lot of patients are on it. So that's going to be one that we're probably going to be seeing a lot more talk about in the near future.
Oh, that'll benefit a lot of patients then, because there are so many people who do take statins. We actually have another caller, Larry from Roane County. Larry, go ahead with your question.
Yes, I'm on Coumadin and atenolol. I have an artificial heart valve, and my heart specialist told me I used to take like if I went to the dentist or something and had to come off my medication, I'd do Lovenox. I think I'm pronouncing it right. Mm-hmm. And he told me that that's not recommended now, that I need to go on heparin instead. And I was just wondering what your thoughts were on that.
Well, Larry, you said you had an artificial heart valve, right?
Yeah.
Is it a mechanical, or is it like from an animal?
No, it's mechanical.
It is mechanical. Well, at least in terms of what I know, if you need to come off of the Coumadin for some kind of a procedure, and you have, and this, when they switch you from the Coumadin to a drug like Lovenox, that's called bridging. So it's to still protect you from developing blood clots, okay, as a result of the what's called turbulent blood flow in the valve. And as far as I know, using Lovenox, if you use the right dose, okay, is still appropriate for that kind of a bridging sort of procedure. So I'm not personally aware of any new recommendations that say not to do that. It's a lot easier actually to be on Lovenox because it's just an injection under your skin, as opposed to having to be put on an IV, with a pump, and then have the drug like the heparin infused over a long period of time prior to whatever they're going to do. So far as I know, I think it's okay with the Lovenox bridging.
Coumadin in general has so many side effects associated with the interactions that patients have to be really careful with that drug in particular.
Absolutely.
We actually have another caller also, Teresa from Upshur County. Welcome to Doctors on Call. Teresa, go ahead with your question.
Yes, I heard that gluten is in a lot of medications. Is that true?
Well, gluten, the celiac disease,
Yes.
and how it affects your GI tract, and how people get all kind of bad symptoms, and they have cramps, and they can't tolerate. I know that's part of wheat, obviously, and wheat sort of based products, breads, and a lot of different sorts of products and foods have gluten. Frankly, I'm not aware of any medication or tablets or some of the fillers that are inside that they have gluten or from wheat. So lactose, yes, because that's a common sort of filler in the capsule and tablets. So if you have a lactase deficiency and like milk, where you can't take milk and dairy products, that could be an issue with certain products. But as far as I know, gluten, I'm not aware of that. It's certainly not common in the tablets.
I haven't heard that either.
Yeah.
Okay. How about antibiotic overusage? It's something we're hearing more and more about with the development of MRSA. Any certain antibiotics that you feel like patients should be more careful of? I know that sometimes people are given refills on medications and just go ahead and start them without necessarily seeing their physicians. Any kind of caveats or warnings that you give to patients about antibiotic overusage?
Sometimes I think that we're too quick to run to the doctors and request an antibiotic because we aren't letting ourselves fight the infection off on its own time. And sometimes, especially with viruses, we don't use antibiotics to treat that. So sometimes we're taking it too early, and that can lead to antibiotic resistance by taking medications when we don't really need them, whenever our body can just fight it off on its own.
Great. We actually have our youngest caller of all time on Doctors on Call. We've got Michelle from Mercer County, who's 8 and has a question for us. Michelle, go ahead, hon. What's your question?
My question is, though, any side effect side effects on Pepsi.
Pepsid. So I think she's asking, are there any particular side effects associated with Pepsid?
Well, let me ask, do you actually take it, Michelle?
Yes, I do.
Okay. And have you done okay with it?
Yeah.
Yeah, well, most people who take it, I think, do pretty well with it. Sometimes I'll see patients that'll have some diarrhea, loose stools with it. And it could become an issue or a problem if you were much older, where if your kidneys weren't quite working as well as they should, it might be an issue. But basically very little in the way of bad side effects. So since you're doing so well on it, obviously you continue it. So it's a pretty relatively safe, I think, medication as far as
No particular side effects in children versus an adult that we know about?
No, not really. Not that I'm aware of.
Well, thanks for your call, Michelle. In terms of over-the-counter medications, so many people are taking over-the-counter medications rather than, or in combination with their prescription medications. Any warnings about herbal drugs, vitamins, supplements, anything that you think the audience really needs to know?
I would say you need to make sure that you talk to your doctor or pharmacist before you try a lot of the herbal products. I know that the vitamin sections are growing, and there's many different products with many different things in them, and we need to make sure that it doesn't interact with any prescription medications. So it's always best to take something up and ask the pharmacist. A lot of them do have warnings on now. Ask your pharmacist if you have certain conditions, but it's always best to be safe and go ask if you have a question about an herbal.
And also, a lot of the herbal drugs can interact in such a way that they can prolong your bleeding time. So I think if you're going to your physician, you may be anticipating a surgery, you really need to disclose that you are taking something over the counter rather than assuming that, because it's over the counter, there's nothing in that really could cause a problem, because certainly there are herbal drugs that can lengthen the bleeding time and make you at risk for bleeding during surgical procedures. In terms of foods, are there any particular medications that have problems with specific foods? We talked a little bit about grapefruit juice and statins, and how real is that interaction for patients?
Well, it's real if you consume a lot of grapefruit juice and some of the statins, the drugs that are used to treat high blood fats or high blood lipids. It could, potentially prolong the action and maybe lead to adverse effects. Even certain anti-drugs used to treat high blood pressure with grapefruit juice could also lead to maybe a more pronounced effect, may actually drop pressure lower than you might consider would be safe for a given person, where they may now develop side effects of lightheadedness, dizziness, they may faint. And then there's other medications that actually will even interact with alcohol. One common one, which is an antibiotic called Flagyl, with alcohol, it can make you somewhat sick, nauseous, vomit, make you feel pretty awful. And so anybody who's taking that kind of medication should probably stay away from alcohol while they're on it, and then for a day or two afterwards as well. So there's a whole host of of foods, alcohol, herbal products that have the potential to interact with medication.
We have another caller, Enga from Raleigh County. Enga, you're on Doctors on Call. Go ahead with your question.
Sir, I have a question about Ambien. You always read that you should only take it for 10 days. I have taken it for quite a long time. I take it 3 to 4 times a week. I have a very hard time sleeping. And I just wondered, is there any really bad side effects to that medication?
So Ambien, again, just for everyone else out there, is a sleep aid. Mm-hmm. And how does that work? What are some of the problems with taking it over the long term maybe versus the short term?
Inga, can I ask, does it still seem to help you, even though you've been on it for a long time?
Yes, it gives me at least 4 hours of solid sleep.
Yeah.
I have arthritis and spinal stenosis and 4 ruptured discs. So it's hard for me to get comfortable.
Well, all the various sleep aids that are prescription products were developed to be used on a short-term basis. And if somebody still had problems sleeping after the long term, then they should, the whole idea was that they need to discuss that with their physician or with their family doctor or other primary care provider to kind of sort out what the cause of the sleep problem, truly is. Now, I also know that, and one of the things I like to preach is if it ain't broke, don't fix it. And when a person is literally, taking a medication that was intended for just a few days or a week or two, and they've been on it for 10 years, but yet it still works, then, I say leave it and don't necessarily change it. But they were really intended to be used just on a short-term basis to kind of get people over the hump when it comes to inability to sleep. So they do help you sleep. They may not prolong the duration of sleep. They may help you fall asleep. And it sounds like that's the case with you, but it's not really giving you a longer sleep than maybe 4 hours. So I think, might be worth seeing your family doctor to see if maybe there's another approach. And there's so many other non-drug ways to help you sleep that probably are going to be as effective, maybe more so. Not what you're taking. Some of the medications that you take, kind of the Valium type drugs that they use to help people sleep, if you kind of pull the plug and you just stop it and you cold turkey it, you literally could go into some serious withdrawal effects, even to the point where some people have actually even had seizures. So I don't take that lightly. Ambien, I don't put in that same kind of, category. But I think it might be worth a visit to, or at least a phone call to a family doctor.
Of other options.
Yeah.
We have another caller, Betsy from Taylor County. Betsy, go ahead with your question.
Thank you. I have a severe egg allergy, and my doctor recommended that I get the flu and the pneumonia vaccine. And I've tried to get it, but everywhere I go, it has egg in it. It is made by the egg. So is there a vaccine available without egg this year?
Betsy, that's a great question. And I would recommend against getting the vaccine because it is made using egg products. So if you have a severe allergy, I would say definitely don't get the vaccine because you could have a very severe reaction from that. So I would take all the other necessary precautions to make sure that you don't get sick this flu season. Make sure you're washing your hands and all of those types of things. Keeping common areas clean so that you can protect yourself from the flu in other ways besides getting the vaccine, because the way it is grown, I would be very hesitant to recommend that to you.
In terms of flu mist also, that would apply. So it's not only the inactivated vaccine, but it's also the nasal form.
And the nasal form is also, it has a very narrow range of who should get it. It's a younger age group, and you have to be very healthy to be getting that type of vaccine as well. So.
We have another caller, Peggy from Wetzel County. Peggy, go ahead with your question.
Okay, my question is about Actose. I take it for diabetes, have taken it for a long time. Recently, I've seen ads on TV saying that Actose causes liver cancer. I called my pharmacist, and he says that's just attorneys looking for business. Is there really anything to the problem with Actose?
Anything with Actose that either of you have any information for this?
No,
one?
Actose is a medicine that's used to treat type 2 diabetes, and it's a fairly effective, drug to treat diabetes. And I'm not aware of any association with that causing liver cancer. And so I think you should be rest assured that, there's really no evidence that it causes liver cancer. And if it seems to be helping and controlling her blood glucose, then I would say, again, like I said earlier, if it isn't broken, don't fix it. And I would certainly continue taking it. The only thing to watch for, though, on occasion, is that it could cause you to retain fluid. So if you notice any puffiness or your ankles may swell, just, you're just puffy, the legs perhaps, then I think you should see your primary care physician, see your family doctor, to see if it could be the drug doing that. Because now we have such a wide variety of medications that could be used to treat type 2 diabetes that if that one doesn't seem to be helping enough or you get side effects from it, we have a whole host now of newer medications that could be just as effective.
Great. Diabetes in general, it's difficult in terms of making sure that there are not drug interactions, using over-the-counter medications. Gretchen, anything about over-the-counter medications and diabetics?
Especially with this cough and cold and flu season coming up, There are many sugar-free options for cough syrups that I would recommend to the patients with diabetes. Any other medications, I would definitely make sure you talk to your doctor or pharmacist before you take the over-the-counter medications along with your diabetes medications.
How about adjustment of the insulin dose? Does that need to be thought about when you're taking additional medications? Does that tend to affect their insulin levels?
As far as insulin dosing, when patients are sick, they might require different amounts, but they should definitely talk to their doctors or their pharmacist.
Great. Well, we've been talking about medications with pharmacists Dr. Charlie Ponte and Dr. Gretchen Krekel. Thank you both for being with us. If you'd like more information, talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. Maureen Hashmi. Good night and good health.
Join us again next week for Doctors on Call. Our topic will be breast cancer. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.